Tēnā koutou, tēnā koutou, tēnā koutou katoa. I'm Nivedita Sharma Vij from Counties Manukau Health, and I'm working as a lead health coach at Counties. We are talking about what is diabetes management and what we should be doing. We should be working with our patients. But through health coaching, we are actually doing it how we can actually achieve what we should be doing as clinicians and working with our patients. So I'm actually going to start my presentation with a role play. So I would like to invite my colleague, my super health coach, Lorraine from Mangri Health Center. Lorraine, could you please join me here? So we are just going to give you a demonstration of what usually happens in the clinics and what is happening in health coaching to begin with. So please don't take it to heart. It's not we are saying it's happening in the clinic. It's just a mere example of what's happening when we are time poor, when we are rushing and we know that lots of patients waiting for us. There's a big queue there. And yeah, so Lorraine, shall we start?
Hi, so we've got two scenarios. Kind of going back to the health literacy team about, it's called Ask, Tell, Ask. So we've got two scenarios of how this might run. So the first one, we won't tell you what it is.
You need to decide yourself.
You decide which one it is. So first one is, I'm the coach.
Yes, and I'm the patient.
Okay. So, Mrs. Johnson, this is a chart of your HbA1c.
Oh, okay.
I'm very worried. Your HbA1c is almost 80. Mrs. Johnson, that is too high. You know it's supposed to be 55 or lower. You really need to bring your HbA1c down from nearly 80 to 55. If it stays high for too long, you may have a heart attack or stroke. You could even die.
Oh.
Yes, a high HbA1c is very bad for your health and can be dangerous. You have to take the medications the doctor prescribed, and you need to eat better and exercise more.
I'll try. However, is it okay if I start eating better after my niece party tomorrow? I can't get my medication until I get paid, Lorraine.
Mrs. Johnson, it's up to you. You have to control your diabetes.
What? I have diabetes?
So that's the first scenario.
So please think about how Mr. Johnson is feeling during this consultation.
I'll use the same names.
Yes.
So the next one.
I'm Mrs. Sulasi.
And I'm the coach. Would it be okay if we talk about your sugars or HbA1c now?
Yeah, it's okay.
What do you know about HbA1c?
Not much, Lorraine.
That's fine. Let's go over it together. HbA1c tells you how well you are controlling your diabetes. Mm-hmm. HbA1c tells you how your average blood sugar has been doing for the last 3 months. So it's kind of like a video. A glucose meter reading from a finger stick gives your blood sugar at the time that you prick your finger and can be affected by what you have recently eaten. So it's kind of like a photo. HbA1c tells you how your blood sugar has been over time. Just to make sure I was clear, what does HbA1c measure?
I think, Lorraine, HbA1c is average of my blood sugar over the 3 months. And is that right?
Yes, that's correct.
Cool.
Why do you think we care about your HbA1c number?
Well, I'm not sure. I think you said it showed something about my diabetes.
Yes, your HbA1c number is another way to measure how your diabetes is doing. Can you tell me what your HbA1c number is?
I think I'm fine. I'm feeling fine. Yeah.
I am happy you feel fine. We hope that you continue to feel good. Sometimes your sugar can be high and you still feel good. One way to keep feeling great is to keep your sugars at a healthy level.
Right, okay.
Let's look at this chart of your HbA1c together.
Oh, that's my one.
Yeah, so
okay.
Can you find your most recent HbA1c on this chart?
Well, it's my eyes. I forgot my specs. What is it, Lori?
So it's here, and it's 95.
Oh, okay, yeah, it's
Yep.
going up. Yes, it's
And
90.
where is your goal?
Is it the line in the middle?
Yes, and
It
that says
55 or 60?
yes. So your HbA1c is 95.9 now, and you want your HbA1c to be 55 or below to keep feeling good. What do you think about that?
I think I was there in last November, just before my niece's wedding. Yeah. But I don't know what happened.
What do you think you were doing before to keep your HbA1c at your goal?
I was exercising more with my girlfriends. And I remember I used to go and walk every day with them.
That's great. Physical activity is one way to keep your HbA1c low. Is there anything else that keeps your HbA1c at a healthy level?
Not that I can think of.
There are 4 things you can do to bring your HbA1c down: being active, healthy eating, taking your medication, and managing stress.
Stress.
Which one of those sounds like something you want to do to help bring your HbA1c from 95 to a 55?
Well, maybe I can check with my girlfriends and start walking again. Lorraine, will that be helpful?
Yeah, that sounds like a great idea. Maybe we can make an action plan together to help you start walking.
Oh, that's great. Let's do that.
That's good.
Brilliant. Thank you, Lorraine. So that's an example of how we do our conversations, how we talk to our people, our patients in the consult room. So it didn't take much time, but it was engaging the patients. Do you feel the same way? So Lorraine, I have this opportunity that Lorraine is here present, and I have grabbed that opportunity to actually let her share the journey she had from nursing to health coaching. So Lorraine, would you like to just share a little bit about health coaching to give others the flavor that what it's like?
Just a bit of background. I've been a nurse for about 9.5 years, and I did the health coach training just under 3 years ago. And again, I work in South Auckland. Myself and a GP, we manage about just over 200 patients with diabetes alone. So that doesn't include pre-diabetes and your other long-term conditions. So that's quite a large practice. I'm a big fan. It's brilliant. It's helped me, become more effective as a healthcare professional. And I've learned a lot of skills. Done a bit more education around motivational interviewing, health literacy, and we just work with the patients, or patient-centered care. So keeping our agenda in the background, it's always putting the patient first. Initially, when we started about 3 years ago, it was myself and a GP and a junior nurse, and we kind of played around with the idea because we figured, what we were doing in the past, it just wasn't working, telling the patient. Basically, there's 2 scenarios. The first one was a scare tactic, and the second one was the collaborative relationship with the patient. And we found since then, adapting, our model of care and how we look after these patients is that at the end of the day, it's the patients, what's important to them, what they can do, and how confident they are and motivated they are. Because no matter HbA1c 100, that doesn't mean anything to them. They don't understand what that means. And you as a health professional, you'll see the end result, going to go into dialysis and all the other complications of diabetes, but they're living in the moment. So they feel well, they don't see the reason why they have to take X number of medication. So my role as a health coach, when I first started, it was a bit tricky. I thought nursing, my role as a nurse, as well as a health coach, I thought it was 2 completely different people. But over time, I've learned I'm still a nurse. The health coach skills I've learned along the way, it just helps to complement how I provide care to the patients. And I don't work by myself, so I've got a really good supportive team of GP. We've got a health improvement practitioner / health psychologist on site. I've got a peer health coach, and also I've built relationships with, the diabetes specialists, diabetes nurses. So if I'm stuck with something, I'm honest with the patient. I say, look, I don't know what the answer is, but I can help by finding out about that and getting back to you. A lot of the time is important setting the agenda. When they come in with, I need my medication, I've got a sore throat, so I can set that agenda. And then, is it okay if I talk to you about your blood test recently, or how are you getting on with your sugar testing, all those things. And then they go and see the GP, and then they come back and see me to reinforce the plan. So let's summarize, you've come in here today, doctor sorted out your sore throat, you've got your prescription. Is there anything from today's visit that you weren't quite clear about so that I can clarify for you, all those sorts of things. And we've seen some good results. We're also part of a health coach pilot, and we're in the process of gathering some data soon. And like I said, we've seen some great results. I remember my first patient, early 60, Samoan lady who had pre-diabetes, then had knee issues. Surgeons would not operate on her because, unfortunately, she went on to have diabetes. HbA1c went up to 96, and due to post-op complications, the surgeon said, "Nope, we're not going to operate on you until you get your diabetes under control." And she was so upset about it, and she refused to go on insulin. And so we sat down, talked about what was important to her. Her goal was, she used to walk all the time, hence why, pre-diabetes, she kind of managed it and went back up and down, over 40, under 40. But with the knee problem, it stopped her from being active. So we did a lot of action planning, virtual reviews, and within 4 or 5 months, got her HbA1c from 96 to about 52. Surgeons were happy. She has surgery. In 2 months to this date, her HbA1c is still in the late 40s, early 50s. So, and still no insulin. So a lot of our patients, they don't want to go on insulin. So again, it's finding out what's important to them. Yes, we can acknowledge you don't want to go on insulin for various reasons. But what would you like to do to help get your diabetes under control? So it's not what we want them to do, it's what they want, and they're motivated and have the confidence to do that.
Thank you so much, Lorraine. And this is what I hear from my health coaches all the times. Thank you so much, Lorraine. And I thought it's good to have someone who is actually active there, doing health coaching and making that difference. So I've changed my presentation. I know I'm very limited, I'm very time poor, but I try to make that time effective for all of you, to listening the actual experience of a nurse transitioning into health coaching and then putting all those skills together to help our people to help themselves. And I've got a few of my health coaches here as well. So hello, everyone. Thank you so much for being part of my team. So I'll quickly go through the pilot we are running at the moment for health coaching. Is why we would like to design and implement a health coach role as an expanded function of our general practice. Because we know that our general practices are part of the system, and we are trying to make it the heart of our system, because I know that's where the preventative stuff happens, that's where the actually care and treatments happen. And we would like to actually robust our primary care system. So this is the kind of evidence we're trying to prove. And as I said, I'm hearing the stories, we're trying to capture that, the empowerment element that's happening with our pilot patients, to actually bring that to you to share. It's happening, what Kate was saying, what we should be doing, and we will be bringing on how we are making that happen through health coaching. So how we actually started the pilot, we did the practice engagement through our PPC, Planned Proactive Care Learning Sessions and Information Evenings, and some really brave practices. They put their hands up, and then we call them actually self-identified. It was not through any PHOs, any DHB initiation. It was the practices saying, yes, we want to try that. We want to learn how it works. And these are the list of the practices who put their hands up for the pilot. And these are the practices I'm supporting to actually integrate health coaching. When I say integrate health coaching, it's not just a health coach coming in and doing health coaching. It's part of the general practice team. It's their team member being trained, mentored, and supervised, and empowered to actually run health coaching for their people, for their practice enrolled patients. So we had our inaugural health coaching workshop in September and 2017, followed by January, June, and October 2018. The training was run by Health Navigator, Health Literacy New Zealand, and Nirvana Group for UPC model of health coaching. And at the moment, we have 65 health, which is like clinical health coaches, and peer coaches from primary health sector. So at the moment, 29 people are being supported under the pilot. And these are some of the lovely pictures of our trainees, trainers, and the way we run our training in Counties Manukau Health. So this is the very first feedback of our training, and people were really kind of blown away along with us. We had our learnings, we had feedbacks. So our next cohort of training actually based on all the feedbacks and learnings we had from our trainings. So we keep improvising and keep adding on what works, what didn't work, and how we can make that happen. So this is something when we say we design and actually tailor to our practices, journal practices. This is what we work with in each and every self-identified practices. We've gone through the processes, we've gone through, how the system, what's the team culture, what's the environment of the practice, and we try to adapt health coaching models based on their strengths, their ability, as well as what they want to practice health coaching within that practice. So there's a huge amount of work being done at the front, but also in the background to support and integrate health coaching. So these are some of the example of team-led model of health coaching. You will be having my slides, so please go through that. And if you have any question, you have my contact. I'm getting a waiver that I'm running out of time. And just a quick one, another model of process mapping from another practice, which is a big practice with multiple number of GPs and nurses and healthcare assistants. So my role at Counties Manukau at the moment is running the pilot, supporting the pilot practices with planned corrective care and enhanced primary care team, co-designing and tailoring to the clinic model of care, exploring, developing and conducting health coaching training workshops, working with subject matter experts like Leona and Janine Bycraft, monitoring, mentoring, reviewing, supervision for newly trained workforce. All right, okay. So please have a look at my slides. This is the training we are working, but on the top of the training, we are scoping what other skills and what other learnings health coaches can have to build their role. And this is the incentivizing practices to consider health coaching roles, because we know that, we need resources to run that. And just the last one I want to give, this is the point of difference, and I would like you to actually go through that. These are the exact testimonials our health coaches and the patients who have gone through health coaching actually said, expressed, and shared with us how they're feeling with the health coaching. So that's me.
All Nivedita's fantastic presentation will be up on the Goodfellow website along with all the presentations from today. So we will have the chance to have a look at it later.
Thank you so much.